Uh, I'm I'm going to hop in here right now so that we can finish up our last section for the Critical Access Hospital Awards. We'll be doing just like we did before, where I will just introduce this video real quick and we'll play through the next three, which will be the final three awards that we're giving out today. So the last three we have are for the Outstanding Critical Access Hospital Leadership, which will be going to Chris Butler with Adams Memorial Hospital. The Critical Access Hospital Community Partner, which is going to Duke's Memorial Hospital and United Way, and the Innovation and Quality Improvement Award, which was received by Indiana University Health's Paoli Hospital. So with that, I will go ahead and step out of the way so that we can see each of them receiving their awards.
Hi, I'm Lydia Borrell. I'm the quality manager here at Adams Memorial Hospital in Decatur, Indiana. We're a 25-bed critical access hospital and independently county owned. I nominated Chris Butler for the Critical Access Hospital Leadership Award. She came to us a couple years ago as Assistant Chief Nursing Officer, quickly got promoted this past year to Chief Operating Officer and Chief Nursing Officer. She has prioritized patient experience, and that's the main focus of why I nominated her for this award. Patient experience was something we always prioritized here at Adams, but Chris really challenged her leaders to keep it close to them. She started sharing comments reports and really channeled the voice of the patient, which is the most important feedback we could ever receive from our community. So Chris empowers others as a leader, not for a good job or even an award like this, but rather to keep the focus on our patients and what we do well here every day. And she deserves this award for that.
Thank you, Lydia. My name is Chris Butler, and I am the Chief Nursing Officer and Chief Operating Officer here at Adams Memorial Hospital in Decatur. And when I started here right at the start of COVID, I crossed paths with a nursing leader who was leaving at that point. And she told me that she felt that the biggest challenge, even beyond COVID, was that nurses weren't really heard here. And that became the ultimate challenge. And that really became the direction for me, was to work within this organization and with the people at this organization to find a way to make sure that the nurses were heard and that the nurses were seen and the nurses became recognized. And with that piece, we were able to find ways that mainly came from staff about how to recruit and retain them and how to encourage them and inspire them and how to really give them the tools they needed to be able to maintain contact with our patients during COVID, to work with their families, to make it feel like an experience that wasn't at the worst time in the world. And my philosophy on leadership is just, this isn't about me. This is not my award. This is, I'm honored to be able to represent the Adams team that I work with. Without question, the finest nursing group I have ever had the opportunity to work with and represent. And I feel that that's the only reason that awards are okay, because they are so special and they have worked so hard to keep close contact with patients and with their families. And they know everyone by name, even if they just meet in minutes. I don't have any difficulty trying to motivate them ever. They don't need that. They inspire me and they inspire most of our leadership team, because that's what this has all been about. This has been about how do we even maintain patient experience during COVID, yet we were able, I think, to do that and more. And we were able to start sharing patient feedback, to work on patient and family experience together with real-time feedback. And it has just been the most amazing opportunity for me to be able to share this time in my career with this group of nurses and professionals that I work with. Without question, the finest group that I have ever had the chance to work with. And I think together we have made sure that nursing is heard here. Nursing knows that they're seen here, and they know that they're part of every discussion that we have every day. What can we do to make it better for them? What can we do to help them make it better for their patients? And that's really what it's all about.
Well, good morning. We're so happy to be here as representatives of the State Office of Rural Health. I just want to tell you a little bit about this award. It started 5 years ago when our director, Ann Alley, shared with us that she really wanted to do something to recognize rural hospitals and all the work that they do. Rural, obviously, as you know, does not get all the attention it so many times does deserve, and really wanted to do something special. So this award process started about at that time, and we have many categories that hospitals can apply and share that they work with us. And David's program that he'll speak to provides the funding for this. So we're so happy today to be here and present you the award as part of our selection process. So I'm going to turn over to David Conrad right now so he may do the presentation.
So, like I said, we've been doing this for about 5 years now, and it's one of my favorite things that I get to do because, like Joyce said, there's not always a lot of recognition for hospitals at the rural level, and so we want to make sure that you know that we know up at the state level. So this award in particular is going to both Dukes and United Way for their work on the Dolly Parton Imagination Library. With one of the things we realize is that health doesn't stop at the hospital; it keeps going out to people, and so to take something that is so important, which is making sure that kids are educated, that they're able to read, and they carry that forward because it's one of the best ways to give them a better shot further in life. We wanted to award both of you guys for the Community Partnership Award. That's one.
Oh, thank you. Thank you. Thank you so much. Appreciate it. Thank you.
Congratulations.
Awesome. Yeah, that's awesome too.
Debbie, it is so exciting that we've been able to be an outstanding critical access hospital and interacting with you guys. This Imagination Library has been a passion that we have shared since the inception of it. And to know that we're making such a difference in literacy in Miami County is just awesome.
I know.
So congratulations to you.
Congratulations to you too. I'm excited to be able to say that we started this back in 2009. This was a dream of mine. I saw Dolly Parton at Detroit in 2009. I came back with a dream with wanting to expand in rural Miami County. They said that we couldn't do this in a small rural community. I met with all 3 superintendents in Miami County, Duke's Hospital and you, and decided that we could implement this in Miami County. And we had a dream back then in 2009. The dreams come to fruition. And we have now exceeded 51,000 books to children in Miami County. And I just want to say thank you to Duke's Hospital. I want to say thank you to the nurses that give out these application forms to the parents. And they fill that out and send it to our Miami County United Way every month. And we're able to succeed and be able to make sure these parents have these books for these children. And I just want to say thank you, Deb, for making this come to my dream. Thank you very much.
So IU Paoli, we're here today at the State Office of Rural Health to present you with the Innovation Quality Improvement Award. And I just want to share with you that as we were going, through the numerous applications for this award, yours just really stuck out to us because of one, the project that you chose. What a massive project that was and what a huge impact it was to look at this hospital-acquired infection and the impact that it can make on your patient safety. And then 2, recognizing what extreme hard work and passion and commitment that it took to, with the results that you obtained, that not only are impacting your patients, but now throughout your whole healthcare system. And that's huge. And then 3rd, recognizing that this was not done in what we call normal times, but it was still done in the pandemic and all those issues that you're still incurring within your walls. And again, just recognizing what level of commitment and compassion that took. And so it is with, great gratefulness. That's not a good word. It is with great gratitude that we recognize that. And even though we feel like this plaque is not really resemble our true appreciation for your work, David is here to present it to you.
Okay.
Thank you very much. Well, on behalf of IU Health Paoli, we really appreciate your recognition for all of the hard work that we did. And it's just a great honor. Thank you so much. Thank you. After an extended period of time, we hadn't had any hospital-acquired infections at IU Health Paoli. But unfortunately, in January of 2021, in the middle of a pandemic, probably the worst time for us, we identified a hospital onset C. diff case here. So it spurred us to call to action to see how we could prevent these events moving forward. We recognized that there was an opportunity to improve our diagnosis of C. difficile. After reviewing our hospital onset cases for the whole South Central region, and we looked at quite a few years. We had to go a long way back for Paoli because we haven't had infections. We identified that we could do a better job of diagnosing cases promptly on their admission. So the new nursing protocol has empowered frontline nurses to test patients who have symptoms of C. difficile in the emergency department and on days 1 through 3 of their hospital stay. When you hit day 4 and beyond, that is a collaboration with nursing, infection control to ensure the test is aligned within the diagnostic stewardship process. Evidence over the last decade has indicated that C. difficile may be overdiagnosed in hospital settings due to the use of PCR testing. And because of this diagnostic stewardship, it is needed when determining who to test for C. difficile. Our process was designed to ensure that we had high reliability around patients who were tested for C. diff. The process works like this. I'm the infection preventionist for IU Health Paoli, and 7 days a week, I review cases and patients who are at risk for C. difficile, and I collaborate with the nursing team on patients that I've identified. I make phone calls, I talk with the team on the weekends and every other day of the week. If the requested test is not aligned within the diagnostic stewardship algorithm, the infection preventionist thoroughly reviews the patient's clinical course with the provider. If a consensus on need to test cannot be reached, further engagement with additional providers will occur until a decision on testing has been reached. Our testing is approved, and once it has been approved, the nursing will fix a label to the specimen container confirming that the test is approved to run and will then send it to the lab. And they need my sign off as IP to do that. And I'll let Jess speak to the next process.
When I spoke to the nurses to see what was some barriers, see what part of this had we not thought about. We educated, I made a big board, put up all the stuff, gave them everything that they needed, but still wanted to know what was the problem that we hadn't thought of. And we realized that all of our supplies weren't in the same place. Like the stickers were up in a book and the specimen cups were over here. So when we were missing stickers and stuff, it was because we weren't making it easy on their workflow. So we moved to where all the barriers were taken down as best that we have found. We put the stickers in with the specimen cups. We have put a sign above the specimen cups reminding them and showing them the days and times so they can figure out what day of the hospital stay the patients are on. We also noticed in our policies, sometimes people didn't want to spell out the whole word. They were just looking for C. diff. So we had that added to the policies. So when the nurses need to see if they can collect, they can find it a whole lot easier. And then besides that, I've done one-on-one spot education with all the staff members. Because as nurses, it's really hard if a doctor orders something to not just go ahead and do it. And in this case, we're asking them to stop and think if it is appropriate and not just follow the order. So one-on-one, I like to stop and ask people and just role play that I'm the doctor, going to give them an order and see what they say and re-educate if needed or compliment them if they go ahead and say, no, I can't do that, or I need to talk to Teresa.
And I'm always available. I carry a call phone, so I'm on 24/7. And so I've had a lot of discussion with the staff, and I'm happy to say that we're more than 600 days with no hospital-acquired infections. So we are very proud of our team. It's hardwired now, and we're just really excited and so pleased. And thank you so much for this award.
We appreciate the recognition.
All right, so there we have it. That's all the awards that we were doing today. It was quite a different experience to get to go out and be able to hand these awards over in person as opposed to uh, just announcing them during this video. So I think that it was worth it in the end, and we had a pretty good time. But now I'm going to go ahead and pass it off for our final presentation today to Phil Ellis to bring us home.